Question of the day. I'm thinking of hiring a biller. What should I keep in mind to optimize my billing practices and policies? So, this is a question that comes up quite often and is a challenge that pro insurance providers will face at some point. If you're doing your own billing, and at some point you might be thinking about delegating this task. So, we're going to talk about a few things just to keep in mind about billing practices in general. I firmly believe that clinicians should stay in their zone of genius and build a trusting team of professionals who can handle the tasks that don't require us. Okay? So, today I'm going to share 8 things that I think you should consider to optimize your billing practices. These are relevant whether you outsource it to an external team or if you delegate it to an employee within your organization. Let's be real. You might still be doing these tasks. I'm talking to you as well. So before we dive into this particular question, I want to take a moment to thank our sponsors and EHR of choice, TherapyNotes, for sponsoring this Q&A. So head on over to therapynotes.com and use our community code MIMH, and try TherapyNotes for free for 3 months with that code. So, ready? Let's go ahead and get started. So first, you want to develop a clear job description with key performance indicators for your biller. This is super important that you have clear guidelines, expectations, and that you keep access to the billing operations. You never want to be in the dark about these things because ultimately you are still responsible. Second, run and review your patient aging and insurance reports. Make sure that you are acting on any outstanding balances, whether it's from clients or the insurance companies. You want to keep these numbers low. Third, clients have the right to opt out of using their insurance at any time. Make sure that you have both opt-out and opt-in forms readily available. Fourth, hire well. Again, I'm harping on this, but it's so important that you establish clear job descriptions, outcomes, KPIs, and the cost of this service. Because at what point does it make sense to hire a dedicated team or person to do this job? Especially if we're working on a percentage basis, this is important. You also want to begin capturing the standard operating procedures and onboarding processes so that you can begin to bring those services in-house or more effectively oversee them if you do decide to hire an external team. Number 5, update your directory information. I know this doesn't seem like a billing task. However, it is important for billing perspective because it can impact authorizations, benefit information, and payment. Again, we want no delays here. Number 6, sign up for the provider alert so that you're aware of any account changes, updates, and new policies. Your biller should have a separate login, not sharing yours. 7, reconcile your electronic remittance device, your ERAs, and your deposits. Have you ever noticed a difference between the ERAs posted in your electronic health record system and the deposit amount in your checking account? This is why we check. Number 8, did you know that if an insurance company pays or processes the claims of payment outside of your payment terms in your contract, that you might be owed interest on the late payment? This is another reason it's important to fully understand and read your contracts. What would you add to this list? Feel free to add to this list in the comments below. Let's share that collective wisdom. I hope this was helpful for you. If you have a question you'd like our team to answer, head on over to our website at masteringinsurance.com, and right in the top corner it says submit a question, and we might pull yours and answer it live in a video just like this one. All right, y'all take care.